I wanted just to begin because, we've been kind of talking about this, haven't we? The past 3-4 episodes. This won't be kind of a new thing for our viewers that have been following along. We're talking about the holistic, we're talking about the integrative, we're talking about bridging. How can we bridge as Muslims these different ideas of health, of healing, of trauma, of spirituality, of the body? So I can't imagine this will be a new perspective for the viewers that have been following along, but for those people that are just joining in, I want to start with talking about mental health not being a solely mental phenomenon. You'll find that in the history of science and philosophy that this idea of the mental being kind of separate from the body came out of Descartes' work, who's a 18th century thinker, who really split, his ideas are called Cartesian dualism or the Cartesian bifurcation or something like that, where really he's talking about the splitting of the mind and the body, the soul, spirit, mind, apparatus, and the body. And this really sets up the beginning of objectivity in some way, that there's this type of, noun over there, and there's a noun over here, and these are separate from one another, and how can I begin to take this and use that and modulate this and manage that, and there's a lack of the subjective, there's a lack of the relational that's oftentimes included in that perspective. And so what happened is, obviously, as that that Cartesian thinking came into medicine and into psychology and all of that, we lost the capacity to see the forest for the trees in some way. And as we understand that the body is not a thing, it's more of an event, it's more of a verb than a noun, we can begin to understand that Descartes really had something wrong. He didn't have the whole picture. And actually, he did some damage in him bringing these ideas, though he may have not been an insincere person in trying to understand these things at a more scientific kind of in the zeitgeist of the time, trying to deconstruct things, understand things, and remove them from the magical and the mythical and all of that. But yet he threw the baby out with the bathwater, because what ended up happening is a dissociation of the conscious experience of the human being and the world around them, including their bodies. And so this is something that's really important. One thinker, his name is Guy Claxton, in his book, The Intelligence of the Flesh, which I'm sure you're familiar with, Sidi Idris, he talked about CADS, the complex, adaptive, dynamic system, which is the body, which is the human being. Complex, adaptive, dynamic system. And in it, he says that, a system is nothing more than a constellation of processes that make up other systems. It's like the whole-on idea, this idea of wholes, parts of wholes. So these are systems, processes that come together as a constellation and form a greater system. And these are all connected like this. So complex, adaptive, dynamic systems. And that's really what I feel the body is. The body and the mind, if you will, the soul, whatever that consciousness is, it's totally interconnected with this idea that we have this, we're in different worlds. We're kind of this gathering of different worlds within. And that's how we hold the mental, the biological, the relational, social. The psychology now, even the emerging kind of science is talking about the biopsychosocial model. It's not just a psychological model, it's the biopsychosocial. There's a biological somatic, there's not just the semantic, verbal, there's also the somatic feeling dimension that's attached to the biology, and then there's the social relational dynamic as well, that all informs the health and the well-being of the organism, that can show symptoms in the psychic kind of sphere and the physical sphere and the relational sphere, but it's all connected in this way. And so in some way, this CBT model that we talked about in other episodes, the talk therapy, just dealing with the mental at the level of the mental only, ignores so much, because we're just at the surface level. and there's so much that's lost in that. And so, I find that to be clinically ineffective and philosophically unsound with our tradition. We don't really understand the mental and all that to be, in the grand scheme of things. So I'm curious, as I kind of open that up here a little bit, what's your conception, Sidi Sheikh Idris, as we talk about the mind, the mental? I know you're also a clinician as well as a scholar. How are you holding these different pieces and making sense of them in your own mind and in your own practice?
Okay, yeah. I mean, what comes up for me from a practice, from a, like a clinical context, is that where we see this showing up, where there's so much focus on I can fix things with my mind. If I just understand things properly, then everything will be okay. I mean, this is probably one of the reasons that brought me into therapy and getting trained up as a counselor and a therapist, was that people were coming with legal questions, and underneath I knew there was something else there that was dormant, that even if I answer this question this person has, it's not going to get to the root of the issue. And that you see that time and time again, that all these things are interconnected, and fundamentally what drives our beliefs are our emotions in so many in so many instances. And to try to address the mental aspect of the belief or the thought, it sometimes creates an even greater conflict with the emotional part of us, because we have these different parts of us that we ideally want to be able to create some sort of communication between them. And the modern world is so fixated on I can will myself through. If I just understand things properly, or if I set my mind to something, then I can bring about change. And there's no doubt that that it's true in some context. But if it's not working, we want to be really curious about, that's a very superficial way of addressing something. And sometimes sometimes a superficial approach can work. But if it's not working, then we need to ask something deeper: is what underlies all that, those thoughts you have about that. And often you'll see there's huge avoidance of emotion. And people really neglecting their sense of emotional well-being. And so understanding that all these parts are in play and in communication with one another, or avoiding one another, and when we create some sort of communication between them, and my clinical practice, it's as I've mentioned in previous session, is this 7 levels of experience, is tapping into those, our sensations, our feelings, our emotions, our behavior, our images that come to us, our thoughts and our beliefs. The moment we start to explore them without trying to solve them, they just sort to start to align with one another, and we start to feel a wholeness. So in the medical model, that's very much influenced by what you've been mentioning, we compartmentalize things. And one of my friends who's a doctor, he said, and even Gabor Mate mentions this in his book in When the Body Says No, is hardly any clinician that asks the question when someone comes with some ailment, like, what's going on in your life?
Right.
Because fundamentally, what this ailment or this symptom, whatever it is, it didn't appear in a vacuum. It's speaking to something far deeper that we need to address, that could be social, like you mentioned. It could be down to family systems, the family system the person's living in. What was it like growing up in your house? Do you feel that you were attuned to? Do you feel people were there for you, or did you feel abandoned? And exploring all these different aspects of ourselves, in terms of diet, in terms of emotional well-being, in terms of social, economical factors, and so forth and so forth. We want to get this full picture,